Okay, let's start. We got a very exciting day today, and I especially like this class because it's a really important topic that we're probably all going to be faced with this fall and winter, and that is pharyngitis, coughs, flus, and colds. So we're going to talk about the homeopathic treatment of these conditions, which can be a primary source of treatment. Homeopathy can be the primary source of treatment, can help you eliminate antibiotics and other conventional treatment. We're going to be reviewing case number 1 and number 2, and I hope all of you have done your homework. Next month, I will require that you send your homework in prior to the class. This time, I was a kind teacher and I gave everybody a break because I understand that some of you really didn't understand the homework, you didn't know what to do. So maybe when I go over these cases, it'll become clear. We're also going to talk about remedy preparation, how homeopathic remedies are made. And this is something, believe it or not, that you can make your own homeopathic remedy. I've made my own remedies. It's fun to do. And it's the way that homeopathic doctors years ago, they would make their own remedy. We're going to talk about case taking, how to handle a case, how to take the history, how to find out what is the appropriate homeopathic remedy. So, in addition to your homework, I hope that maybe you could try to take a case on your own, and we can maybe talk about that. We're going to talk about provings, how homeopathic remedies are studied. And you'll find that the homeopathic remedies were probably studied more thoroughly than most pharmaceutical drugs. We're going to talk about probably the number one book in the homeopathic literature is The Organon, written by Samuel Hahnemann. And this book contains laws of healing and essentially the secrets of homeopathy. We're going to review Materia Medica. Materia Medica are the homeopathic remedies. And already you're starting to learn a few remedies, and we're going to be reinforcing these remedies by talking about cases. And the cases I'm going to go over with you are real live cases. These are people that benefited from the homeopathic remedy. And then we're going to end by talking about common problems of pregnancy, labor, and delivery. And these are two topics that I'm interested in, not because my wife is pregnant, but because I have 6 goats, five of them are females, and 3 are pregnant. I have a pregnant donkey and a pregnant cow, and homeopathy works extremely well in the treatment of animals. And in fact, my wife and I are probably going to be attending um, a homeopathic veterinary seminar, 1 week seminar held in March of this year in Arizona. Okay, we're going to talk um, about pharyngitis. And this is a fairly easily treatable condition homeopathically. But one thing is to keep in mind, and this is a policy that I always use, that give the homeopathic remedy 24 to 48 hours. And if you don't have success, then you need to look at traditional medical care because we're always concerned about strep throat, a serious condition. So sometimes, give it your best shot with homeopathy. And if you don't have success, you need to go to the hospital emergency room and get strep throat cultures and go on antibiotics. But often, the homeopathic treatment will be successful. So this is a fairly easily treatable condition. I advise treating for 48 hours before considering antibiotics. As a homeopathic doctor, I'm against antibiotics, but I think we have to, show our common sense. In evaluating someone with pharyngitis, we have to observe the throat. Um, By that I mean, open up your mouth, say ah, look, and see, are there exudates, discharges, redness, hemorrhage, because all these are essential symptoms and observations that will help you select a homeopathic remedy. Feel for nodes. And what are nodes? Well, if you run your fingers right below the ear and the neck, you can see if there's swollen glands, and these are lymph glands. And if you have a serious pharyngitis or throat infection, sometimes these glands can be extremely large. Also, look in the ears. Those of you that know how to use an otoscope to see if the ear is also inflamed. And you can also use some herbal preparations along with the homeopathic remedy for comfort. These herbal preparations will not interfere with the homeopathic remedy. And I like echinacea tea, and there's also something called throat coat tea, which can be found in health food stores. And this is a combination of slippery elm and some other herbal products. So when you're taking a history, you want to know, was the onset rapid? Is it severe? Was the onset gradual? All these things are important because certain homeopathic remedies have a rapid onset, some have a slow onset. Uh, when evaluating pharyngitis, the side that it's involved, is it right sided or left sided? And many of the homeopathic remedies are strongly right sided and left sided. So that can be a big help. If you have a rapid onset on the right side versus a slow onset on the left side, these are critical. Also, the type of pain. Have the person describe the type of pain. Is it burning? Is it shooting? Is it stabbing? Is it dull? These are very important when we look at certain homeopathic remedies because they have certain features. Also, we want to know, you're going to see this greater sign or less sign, and that's a homeopathic shortcut for ameliorated or aggravated. The greater sign is ameliorated, which means it's made less, and the less sign is aggravated. So, eating and drinking. Um, does it make it feel better or worse? Sometimes, drinking warm water will make the throat feel better or cold. Also, in addition, you want to know changes in salivation. Are they sweating or perspiring more? Also, thirst. Is the thirst increased or decreased? And also, emotional changes. Are they more irritable, less irritable, crying, weepy, all these things? So, just to review, if anyone does have any questions during this webinar, please raise your hand. You have a couple of options. One, raise your hand, and you can also type a question. So I can see the questions, and I'll try to address um, the question at the right time. So here's a list of some of the common homeopathic remedies for pharyngitis or a sore throat. We have belladonna, ignatia, mercurius vivis, mercurius iodatus flavus, mercurius iodatus rubor, hepar sulph, ferrum phos, and res tox. Now, one thing is, I don't want everyone to just say, oh my goodness, these names are so foreign I'm never going to learn homeopathy. And I have to emphasize again that every one of these homeopathic remedies cover a multitude of conditions. So belladonna just isn't for pharyngitis. It can be for many, many other conditions which have a characteristic belladonna appearance. So as you learn these remedies, you will find that they apply to many, many different situations. So my advice is to be patient, take notes on these remedies. And one of the best ways that you really learn a remedy is when you are successful in treating a condition. Then it becomes kind of embedded. You'll remember the time that your child had a belladonna sore throat and you gave it belladonna and the condition quickly resolved. And that's probably the best way to learn homeopathy. So I'm trying to encourage you to don't get frustrated and don't give up. Homeopathy is a lot of fun, especially when you begin to have success. Now, I hope everybody has bought their Kent homeopathic repertory. A repertory is a kind of like a dictionary where you have a symptom and then you have a listing of remedies that are appropriate for that particular symptom. So I'm really not going to spend a lot of time on the repertory during this lesson. We're going to go into the repertory in more detail later. But what I do want you to do, those of you that do have Kent's repertory, and I gave the page number. So if you look on page 451, and that's what I'm going to be doing right here, turning to page 451. And so if you have your book, and I would encourage you, those of you that don't have a Kent repertory, make sure that you have one for the next class. So I'm looking at page 451, and at the top of the page is throat. I see dryness, elongated, emptiness, and then I see enlargement. So at the bottom right of page 451, enlargement. And then you see a list of homeopathic remedies that are applicable for enlargement in the throat, enlargement of the tonsils. Then we have some other symptoms, and I've given you the repertory page. So I'll be giving you a copy of this slide. So when you do get your repertory, you can go to each page number and look at these particular symptoms and the associated remedies. So this is one of the ways when we're studying a case, we try to find the key aspects of what the patient presents, the key symptoms, and then we look in our repertory to find out remedies that may be applicable for that. And let me see. Veronica, you have a question? Hello, Veronica?
Hi, can you hear me?
Yep, I hear you fine. Did you have a question?
Yes, I had a question about rapidity of onset. That's something that always confuses me. For instance, I have right now a cold, okay? A week before I get the cold, I know I'm getting it not because of any physical symptoms, but because I get angry at the slightest thing. And I think I'm getting sick because it's not like me. And then last Saturday, I fell asleep because I had a seminar on Sunday. And I fell asleep at 8 o'clock, and at 11 o'clock, I woke up, and my throat was completely closed. Now, would you consider that rapid onset, or because of those symptoms the week before, is it not a rapid onset?
Well, that's a good question, and I would probably say that the emotional element is really important, because you develop some increase in anger about a week before, but the actual flu symptoms or throat symptoms develop very quickly overnight. So I would say it would be rapid.
Okay,
So when you can pinpoint, like I was fine yesterday, and then
right.
today I woke up, that would be considered a rapid onset.
Okay,
A slow onset would be something, I really don't know when my cold developed. I've just been feeling kind of sluggish now for the last couple of weeks, and now it's really hit me.
okay,
So that would be slow. But then, there's variations. It depends on the person. Are they observant? Sometimes people are in denial.
uh-huh,
And then when you're not certain, then, and we'll talk about this later, then you're not going to use that in your analysis. When we do our analysis, we want to try to hang on to things that we're certain. We always
okay,
try to get the clear presentations that'll lead us to the remedy. So if you're not certain, then you don't use that, sudden onset. Okay.
okay. Thank you.
All right. Um, Now, in terms of actually treating a pharyngitis or a sore throat, the dosing is, and I know many of you have bought the homeopathic remedy kit that I suggested. It's a great kit. I've been using that kit for about 10 years now. It has 50 homeopathic remedies in a 30C. So my recommendation is you use the 30C, the most appropriate remedy, and you take it 2 or 3 times a day for a couple of days. Now, we'll talk a little bit more about dosing. Um, if you don't have any response, then you have to reevaluate. And sometimes you're not going to wait 2 or 3 days. So if someone has an extremely irritable throat and they're in a lot of agony, I'll give them a remedy, a couple of dosages, and if it doesn't change in after 2 or 3 dosages, I'll look for a different remedy. But if you feel that maybe they're getting a little bit better, they're feeling more comfortable, then I would continue it, 2 or 3 times a day. Another thing to remember with homeopathic remedies, it's not like antibiotics. We're all told that when we start an antibiotic, we have to take it for 7 to 10 days. Otherwise, the problem could come back. With homeopathy, once it resolves and once you're feeling better, you can stop the remedy. It's also useful, as I mentioned, to break the remedies down between the right and the left side. That can be very important in selecting a pharyngitis remedy. So let's talk a little bit about the right sided remedies and some of the characteristics that we have with the right sided remedies. Um, the first one is Argentum nitricum. Um, and this remedy has splinter like pain. So they describe it's like a splinter or a piece of wood in my throat. It's also a remedy more for chronic pharyngitis with a lot of hoarseness. Um, and it's interesting that Argentum nitricum is probably the number one remedy for singers. I can remember a case presentation of an opera singer who started to develop some hoarseness and really wasn't able to carry the notes. And Argentum nitricum just worked a miracle with this person. One dose. and all the symptoms went away. So you might consider this, chronic pharyngitis and hoarseness, maybe like smokers, um, elderly people who have chronic pharyngitis and hoarseness. Belladonna is another right sided remedy, and it is probably the remedy of choice for about 40% of all the people you'll see for acute suppurative tonsillitis. Now, acute suppurative, that's just fancy medical terms for a sudden onset of pus. Acute is rapid, suppurative is pus inflammation, tonsillitis is inflammation of the tonsils. So belladonna usually comes on very suddenly with violence. By violence, there can not only be anger in the person, but the throat also looks angry. Bright red, fiery red, a lot of pus, um, and a lot of burning in the throat. Um, Worse, swallowing liquids, cold air, and motion. Typically, a belladonna state doesn't like to be moved. They don't like any type of motion. And there's a sensation of tearing pain in the tonsils on swallowing. The glands are very hard, so when you palpate along the neck, you can feel an elevated gland or a swelling. And the head is hot, and interestingly, the extremities are cold, and they have a desire for lemons or lemonade. So that's a characteristic feature, which is kind of peculiar. But I know that, this was a couple of months ago. I saw somebody with a severe, rapid onset of pink eye, violently red, a lot of burning in the eye, pus. And I was thinking of belladonna, and then the person told me, Dr. Conrad, it's kind of strange, but I've been craving lemons. And I had a big smile because that kind of confirmed the remedy. So, when you're taking a homeopathic case, this is kind of the joy that I have. Whenever these peculiar things come up as a confirmation. And of course, it's always nice when the patient or person volunteers it, but sometimes you can ask them, since you got your cold or flu, have you had any changes in dietary preferences? And so when you hear this, it's confirms. Another right-sided memory is Lycopodium clavatum. And this is also worse from swallowing. The pain extends to the right ear, and symptoms are better with cold drinks. So here, belladonna, um, it's aggravated by swallowing liquids, and lycopodium, the symptoms are better with cold drinks. So sometimes you have to look at these subtleties in determining the correct homeopathic remedy. Um, okay, now let's go to the next one. Mercurius iodatus flavus. And this is firmly on the right side. And all the mercury homeopathic remedies have this interesting symptom of salivation. So there's a lot of discharge from the mouth. And sometimes they will describe that they wake up in the morning with a wet spot on their pillow from drooling and salivation. Of course, there may not be drooling. They just may comment that there's just a lot more saliva that's accumulating in their mouth. You may even see a little bit of saliva on the corners of their lips. Usually it's aggravated at night. All the mercury remedies are worse at night. So we have about maybe 6 or 7 different mercury remedies. They're all aggravated at night. The other thing that they have is a burning pain. All the mercury remedies have a burning pain, heavy perspiration. And there's also a very bad odor or taste in the mouth, and that's also characteristic. So when you see a firmly right sided remedy with the salivation, the bad odor, the burning pain, heavy perspiration, it's mercury, and this should not be confused with, belladonna, lycopodium, or argentum nitricum. So we covered the right-sided remedies, and you'll be getting a copy of these slides, and you may want to make some notes. But at least I feel I can't wait to find someone with a sore throat. So you got to get out there and practice homeopathy. So when you have your homeopathic kit, um, get ready for the cold and flu season. So now let's talk about the left-sided remedies. Lachesis mutans is a big left-sided remedy, and it causes severe pharyngitis, abscesses, peritonsillitis. It is aggravated warm drinks and warmth, ameliorated cold drinks and cold. So that's kind of strange to me because, when you have a sore throat, you would think that the warmth, would help. Um, but this is ameliorated with cold drinks and cold. The lachesis is also aggravated on empty swallowing, and what empty swallowing means is, uh, swallowing with nothing in your mouth. So it's not eating. It's also aggravated at night. The really peculiar thing with lachesis, they get this sensation that something's in their throat, um, and it bothers them. Uh, and it can bother them so much that even pressure on their throat would irritate them. So these people would avoid wearing a turtleneck. Anything tight on their throat would cause pain. Um, the lachesis has this peculiar deep purple on the tonsils, or they can have an ulcer. And the other peculiar thing is that swallowing solids is easier than swallowing saliva, which is also peculiar. So this remedy here, um, you want to make a mental note that it does have some peculiar things. The purple color in the throat, the sensitivity or the feeling that something's in their throat. It's easier to swallow solids than swallowing their saliva. And the other peculiar thing is that they're aggravated by warm drinks and warmth, and ameliorated by cold drinks and cold. Now we have another Mercurius, and you can remember the previous one was Mercurius iodatus flavus. The flavus is the right side, but this is Mercurius iodatus ruber, 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 and this must be left sided. And it's the same exact symptoms as Mercury iodatus flavus, except on the left side. So if you recall, the symptoms of mercury are they're aggravated at night, they have increase in perspiration, they also have salivation, accumulation of salivation. So this is another big remedy for a left-sided. So remember, Mercurius iodatus rubor is left. The flavus is the right. Another left-sided remedy is sepia. And in your studies, you'll learn that the sepia is very valuable remedy in our homeopathic materia medica. Um, and the characteristics that this remedy has, there it's a more chilly remedy, and they have a constant desire to swallow. So this person may be swallowing repeatedly. And there's also an aversion to the family. So if there's a change in disposition, let's say a mother develops a left-sided sore throat, and let's say she was a loving mother, and now she's irritated by the family and wants to be left alone, characteristic of sepia. Um, so now let's look at some general remedies that are bilateral. Apis mellifica, which is the honeybee. And remember, when you are bit by a bee, you get a lot of burning and stinging, swelling, and edema. Um, and that's the characteristics: bilateral, burning, stinging pains. Um, and this is ameliorated cold drinks, aggravated warm drinks, which is a little bit different than the lachesis that we talked about. That was ameliorated um, with the cold drinks and aggravated by the warm. Actually, similar to the lachesis, aggravated. Let's go back and look at that. So, yeah, lachesis is aggravated warm drinks and warmth, ameliorated cold drinks. And apis has that similar characteristic as lachesis, ameliorated cold drinks, aggravated warmth. But a feature in apis is that they are a thirstless remedy. So even though they have a fever and they should be thirsty, it's thirstless. And this is a characteristic that the apis mellifica has in many conditions that you will treat that has this remedy. Because remember, the apis mellifica is not just a remedy for pharyngitis, it can be a remedy for many other conditions: arthritis, conjunctivitis, pneumonia. The characteristic is thirstless and hot. Um, Argentum metallicum is it's a little bit different than Argentum nitricum. The first remedy that we talked about for right-sided problems was Argentum nitricum. This is Argentum metallicum, a bilateral remedy useful for seniors with chronic sore throats, chronic rawness, hoarseness worse from coughing, and a chronic fatigue. So another bilateral remedy. Um, our Arsenicum album is another bilateral remedy. Greatly enlarged tonsils. It has this burning pain, yet they want warm drinks. It's aggravated swallowing, aggravated cold drinks. It's a very chilly remedy, and they like warmth in general. So this remedy, a very chilly person, they like to sip hot tea, aggravated swallowing, aggravated cold drinks, and the Arsenicum album personality is they tend to be very fastidious. neat, um, have a lot of fears. So it's another fairly common remedy, and you might want to consider a differential with the mercurius, because the mercurius is also chilly, um, but they don't have this real desire to uh, become warmth. They don't have that desire to sip hot tea and sipping it constantly. Another bilateral remedy is Baptisia tinctoria, and this is acute painless pharyngitis, inflammation of the tonsils. They're stuporous. Stuporous is kind of semi comatose. They're kind of out of it, very, very sleepy. Offensive odor, which is similar to the mercurius, the odor. Um, the dusky red color to the face, which might be confused with belladonna, because belladonna tends to get a red color to the face. A thick mucus, a dark line in the center of the tongue. They can have very, very high fevers and go into delirium. So, a rapid onset, acute, painless pharyngitis. And maybe it's painless because of their loss of sensation, their stuporous, kind of sleepy, offensive odor. So for me, this is an individual or someone that is you're going to be seeing it's fairly sick, very sick. Veronica, did you have a question?
I do have a question. Can you hear me?
Yep, I hear you, but I think I'm getting some feedback.
I know. That's the computer.
I think it may be best if you do have a headset, then we won't get the feedback. But I can hear you. Do you have a question? Because it's not coming through. I think I lost you, Veronica. If you could, um, please type your question, and then I'll address it. Okay, another bilateral remedy is Burrita carbonica, and this is a remedy to think of in children. Um, Somewhat slow, frequent colds, going right to the tonsils, tremendous swelling, and it usually comes on slowly. Stitching pains, they have to keep their mouth open to breathe. Burning pain, can only swallow liquids. Swelling over a sore spot in their throat, spasms on swallowing makes them gag. So for me, this is um, a remedy that I think of as in children. Children are kind of sickly. They have frequent colds over the flu season. They're kind of slow moving, maybe a little bit on the pudgy side, and they're mouth breathers. When they do get the cold, they're breathing through their mouth. And burning pain, they have trouble eating. They can only swallow liquids. Spasms on swallowing makes them gag. So Burrita carbonica, and you'll find that Burrita carbonica is another major homeopathic remedy that's used to treat many conditions, acute and chronic conditions. Causticum, another bilateral remedy, tremendous rawness in the throat, a sensation that they have to swallow, much hoarseness, and coughing. Chamomilla is a very interesting homeopathic remedy, especially for the mental and emotional state. There's a simultaneous tonsil and otitis or ear problem. They're aggravated by touch, but yet they want to be carried, which is kind of peculiar. Um, this is the kind of child that, you know, is reaching out their arms, please carry me. But then as soon as you touch them, don't touch me. It's kind of an irritable nature. The word is capricious. Whatever they want, when they get it, they don't want it. Their aggravated warmth in general, very hard to please. And what helps me remember the picture of Camomilla is a teething child, very irritable, in pain. They want to be carried, but they don't want to be touched. It's just very, very hard to please. Um, so think of the terrible twos, that age group, chamomilla, and of course, chamomilla tea is a very good tea for teething children. So this is an individual, and it doesn't have to be a child; it can be an adult too, who develops a tonsil problem, has this irritability, hard to please, aggravated by touch. So it can be not only in a child, but it can be in an adult. Okay, I think we can take Veronica's question. Veronica, is your phone working okay?
Can you hear me?
Yep, I hear you fine.
All right. Sorry about this. I seem to have all the questions, but this is something that's really
No,
important
no,
to me. And
never apologize for a question, because for every question you have, there's probably 5 or 6 other people out there that have the same question.
I hope so. But I've always had a problem with just this reading the remedy and figuring out how you pull, like from yours, when I read the materia medica, how do you pull out the ones that are important, like the definite points that you have?
Well,
Because
these
like,
the points that I have are called keynotes. So when
uh-huh,
you start reading a remedy, uh, they all begin to sound alike, but the keynotes are the important features that make these remedies characteristic. And one of the best ways to study a homeopathic remedy is to learn the keynotes, and that's what I'm trying to give you. And this is based on, my experience, the experience in treating patients and family members, and um, so
so
try.
it's not much that it comes from the book, it comes from the experience that you've had and reading the book. So you've been able to figure out which things are important. Is that how I'm reading? Isn't that
Well,
right?
also, like for example, I'm opening up Boriki, and Boriki is a very, very good book, um, for learning materia medica. And of course, when you look up each remedy, in fact, let's go to chamomilla.
Right. I'm right there in Boraki.
Okay, and where is it? Which page is it on, chamomilla?
Oh, it's 187.
Okay, I got it. So you know, so you start. It starts with generalities, and generalities are important. So it kind of goes as you're reading in Boriki. It starts with generalities, and it goes to worse, better, and the mind.
Uh-huh.
And it'll usually tell you in the generalities For example, it starts by saying it is a highly emotional, temperamental, and oversensitive remedy. So that is the key with this remedy. So when you see somebody that's highly emotional, temperamental, oversensitive, that's a hallmark for this remedy. That doesn't mean that every highly emotional, temperamental, oversensitive individual is chamomilla. The next sentence, it is particularly suited for diseases of pregnant women, nurses, and little children. Bad temper, frantic irritability, and snappishness. So if
I
you,
don't have that in mine.
oh, you don't?
Why is that? No, mine starts out chamomilla. The chief guiding symptoms belong to the mental and emotional group which lead to this remedy in many forms of disease, especially of frequent employment in disease of children where peevishness, restlessness, and colic give the needful indications.
Well, it's the same thing. Maybe it's just a different
Way of saying,
translation because I have a different
okay,
version. I should probably get the original version. I have an Indian version. But anyway, it's essentially saying the same thing.
okay,
And that's what you have to do. Um, so, and then as we're studying part of this course, you're going to know that put it in the back of your head that chamomilla is a bilateral remedy for pharyngitis. Of course, it's a remedy for uh, the flu. It can be a remedy for pneumonia. It can be a remedy for just about any ailment, but it has that mental characteristics.
okay.
So
All right. So and that answers my question pretty much. It's really a question of going over and over these and beginning to know them,
yeah, beginning try to you got to pull the important things of each
right?
remedy. Like for example, when I hear the word belladonna, there's pages and pages, hundreds of pages written on belladonna in the Materia Medica. But when I hear belladonna, acute redness, irritability, uh, you know, desires lemons.
Uh huh.
So, and that could be for an acute ear infection. It could be for an acute eye infection, acute onset of an abscess, acute pharyngitis. So that's like pops into my head.
Yeah.
Um, and that's what you need to kind of learn
Okay.
with time, and it's not gonna be overnight. So you'll have your remedy list for pharyngitis, and you have your first case. Somebody comes with a sore throat. Well, the basic questions we talked about earlier: the onset, was it slow? Is it right-sided or left-sided? What's the emotional nature? And then pretty soon, they tell you, well, it's bilateral. I'm irritable. Um, I don't want to be touched, and I have an ear problem with it. Then you're thinking of chamomilla. So
Okay.
as these features come up, you kind of like put them together,
Now,
and
the
then you
one that
learn.
you said about singers,
Excuse me.
the one you talked about singers, was that Mercurius iridatus
Oh no,
folius,
argentum nitricum is a remedy.
argentum?
Yeah,
Would that also pertain to if somebody was a speaker?
yeah. If you get a sore throat
Uh huh.
speaking, yeah.
Okay. All right.
But it may not be. If you look in the repertory, throat hoarseness.
Uh huh.
There's many many different remedies for hoarseness. So it's not like Argenta nitricum is going to be for. It depends on their nature and personality.
Right.
So that's the key. And then that's the purpose of this course. We're going to put all this together.
Okay.
Okay.
Thank you very much. That answers the
Thank you.
question.
Okay, we have another. If there wasn't enough in the way of bilateral remedies, let's get another one. digitalis purpurans. And this is a common remedy with extremely foul odor like a dead animal in the throat. And of course, what other remedy did we cover that had the odor, um, bad odor, was the mercurius. So you can kind of make a list of, the bad odor remedies. Ferrum phosphoricum, a bilateral remedy. A sore throat without many symptoms. Inflamed and hot, desires cold drinks, high fever, red patches on the cheeks. Now, ferrum phosphoricum, I often use this for a cold and flu remedy, and we'll be talking about that later, usually for the end stages of a cold and flu. So maybe they've been treated, maybe even like with antibiotics and other things, and it's like the end stages of the cold and flu, and maybe they're um, depleted. They don't have that many symptoms except for weakness. Ferrum phosphoricum. Think of ferrum phosphoricum. Ignatia amara, a lump in the throat sensation. And the other remedy that had the lump in the throat that we talked about was lachesis. And ignatia, you're going to find, is a emotional remedy, especially after grief. Um, so this is something that you may see very frequently after a death in the family, trauma, grief. They get a sore throat, this lump sensation associated with grief. And as far as I'm concerned, anytime I'm seeing someone with whatever the physical problem is, and if there's an element of grief involved, I always think of Ignatia. Um, so a headache after grief, stomach ache, spasms, vision problems after grief, I think of Ignatia. Hepar sulf is a remedy that you really think of going to suppuration or pus. Rapid onset pus and swelling. A splinter like pain, aggravated swallowing, turning the head, yawning, and it tends to extend to the ears. The other peculiar feature of Hepar sulf is they're very chilly, and they say they're freezing. And any bit of air will make them worse. And we covered another remedy that has this chilliness, cold air aggravation, and that was Arsenicum album. But Arsenicum album doesn't have this really rapid onset and pus. So Hepar sulf, anytime you see something with a lot of pus, a rapid onset. So Hepar sulf can be for abscesses, it can be for um, uh, eye infections, anything with the rapid onset and pulse. Now, it may be confused with um, belladonna, because belladonna can be really rapid onset, but it doesn't have the quickness of the suppuration, the pus formation. And the belladonna is hot, very, very hot, and they're ameliorated cold. Cold makes them better. Also, Hepar sulf is sensitive to pain, so kids will be screaming. They want to be comforted and protected. Um, Lac caninum, and this is a remedy that alternates from one side to the other. So you may hear, well, I'm not sure if it's on the left or right side. It started the left and now it went to the right. So this alternating, ameliorated cold and aggravated heat, pain on swallowing. And this is an interesting symptom, sore throat with every menses. So every time a woman will have a menstrual period, they get a sore throat. So this is what we call in homeopathy a peculiar symptom. So When you see something peculiar like this, it often leads to, um, the homeopathic remedy like this one. We have another Mercurius remedy, Mercurius vivus. Remember, we had Mercurius iodatus flavus, which is right sided, and then we had Mercurius iodatus rubor, which is left. Now we have one in the center of the throat, Mercurius vivus. And this is the number one remedy for strep throat. An apple core in the throat. That's the sensation. Aggravated warmth, night, like all the mercury remedies. Stitching pain on swallowing, and uh, other symptoms that the mercuries have. If you remember, the excessive salivation, the perspiration, and the aggravation at night. And if we didn't have enough of the mercury remedies, we have the mercury uh, corrosivus. And this I think of as extreme mercury. So, mercury that's ramped up. They feel like they're going to die or suffocate. Um, Epiglottis, which is a swelling of the uh, tissue that kind of separates the larynx from the stomach. So whenever you swallow, this prevents food and material from going into your lungs. So this can be an extremely serious problem, and usually these people are on the verge of suffocation. They can't open up their mouth. So in a situation like this, give the mercury corrosivus, and send them to the emergency room. And often, um, this is all you can do. And sometimes, the remedy will take an effect, and they'll get to the emergency room, and the doctor will say, nothing's wrong. But you really don't want to take a chance on an extreme condition like this. But think of the ramped up mercury corrosivus. Nitric acid, um, easily confused with argentum nitricum and hepar, sulf, stitching pains, offensive odors. The thing about nitric acid is they're irritable and very negative. So when you have somebody with a pharyngitis that is extremely negative with everyone around them, and these individuals and irritable, that makes me think of nitric acid. So if you have a case and you're confused with argentum nitricum and hepar, um, and they have this negativity, then think of nitric acid. And once again, many times when you go through your remedies and you're trying to figure out which one to give, it may be, you may limit it to two or three remedies. And, it's almost like a coin toss. And at that point, I would say, you know, use your intuition. Which one do you think would work better? Then give it a try. And once you give the 30C in a couple pellets, you can either give it to them dry or put it in a little bit of water and have them sip it. Have them take it a couple times, maybe 2 to 3 times a day. And after the first couple dosages, if there's no effect at all, then go to the second remedy. If there's no effect with that remedy, go to the third. But one thing, you have to make certain that there's no effect. If there is a slight positive effect, you got to stick with the remedy. It may be that the remedy needs a little bit more time. So then repeat it again. But when you're absolutely certain there's no effect, then go with your second or third remedy. Phytolacca decandra. This is a sore throat with muscle aches. dusky congestion in throat, aggravated cold drinks, protruding the tongue, pains shoot into the ears, swallowing constantly, quite chilly. But let me back up here. So here we have the idea of muscle ache, sore throats with muscle ache, and a sensation of an apple core caught in the throat, and a dusky congestion. So the only thing that would differentiate this with other remedies to help you would be the muscle aches. So this is kind of a more of a systemic remedy, a remedy that has uh, more musculoskeletal. Rust tox. It's a common remedy for sore throats. Restless, achy, wants to stretch. The interesting thing about rust tox, which makes it characteristic, is that they're restless. They like to move and stretch. A good analogy with rust tox is a rusty hinge. They're a little stiff when they first, begin to move, and after motion, they feel better. And they're definitely ameliorated warmth. These are people that the bathtub can't be hot enough. The hotter the water, the better. They like to soak in hot water. And the keynote, if you remember anything about rust tox, this red triangle at the tip of the tongue, tiny red triangle at the tip of the tongue, makes it diagnostic, confirmation for rust tox, this red triangle. Silica is another remedy. This is, I think of silica for chronic sore throats. These are weak individuals that have a low immune system, um, tremendously swollen and sore glands, chronic fatigue, weak, and often a sore throat from getting chilled. Silica. Sulfur, when an acute seems to linger and just wouldn't go away. Hot red orifices. By hot red orifices, I'm talking about the mouth, the rectum. Offensive odors, malaise just don't feel good. So when an acute sore throat just doesn't seem to go away, it just sticks there over and over again. And these tend to be very warm individuals, very hot individuals. Okay, now I want to move right into cough. And what I thought would do is would continue to noon Eastern Standard Time, and then we'll take a 1 hour break for lunch. Um, so let's move right into coughs. Questions regarding pharyngitis or sore throats before we go on. So, what I'd like to do, and of course, I'm going to be available by email for the class. Um, if you do come across somebody with a sore throat, give me your best shot, or give the person the best shot. And if you have any questions, fire them to me. And Veronica, you got a question? Hello, Veronica.
Can you hear me?
Yep, I hear you.
Okay, sorry, it's me again. My question was, if you have a chronic remedy, for instance, my chronic remedy is colchicum autumnal. If I have that chronic remedy and I get a sore throat, would I automatically take my chronic, or would I first go to my homeopath and have it, whatever?
Okay, that's a good question. Veronica asked that she's taking a chronic remedy. A chronic remedy is your constitutional remedy. This is a remedy that helps strengthen you, it acts as a catalyst to help you become stronger. Now, when you do get an acute, let's say you would get a cold or a flu, Most homeopathic doctors would first recommend you repeat your chronic. You repeat your chronic first. So I'm not advising you to take it. If you are under the care of a homeopath, then you should consult with that person on whether to repeat it or not. Because sometimes you'll get an acute situation, a symptom, which might just be an aggravation from your chronic remedy, and you don't want to treat it. You just want to let it ride its course. Then, if the chronic doesn't work, then you would take the acute.
Okay, yeah, that answers my question.
Okay, but good question. Hey, and I just don't want Veronica to be asking all the questions. Either the rest of you are sleeping, and that's one disadvantage of doing a webinar. I can't tell who's sleeping or who's being bored. So don't be shy. Thanks, Veronica. Okay, let's talk about coughs. Um, Coughs, once again, are very, very, very treatable with homeopathic remedies. When I did my homeopathic training, we spent a whole day talking about coughs. And we had some great case presentations. The thing to remember when you're, the things that we covered already, the onset, rapid, slow. But with a cough, we're not looking at right-sided or left-sided. We're looking at dry versus wet. Dry versus wet. So keep that in mind. Also, uncomplicated or simple coughs. By that I'm talking about only a cough. We're not talking about a cough, related to pneumonia or some other condition, like asthma. And we're going to talk about croup, which is specific type of cough in children, and also we're going to talk a little bit about whooping cough. So we'll cover all these areas. Um, okay, Veronica, did your hand accidentally go up, or you have another question?
Sorry, I forgot to put my hand down.
Okay. Okay. And then these are the pages of cough in your repertory. Um, Pages 778 to 811. So those of you that have a repertory, you can kind of look through those pages. The time, weather, position, food, drink, emotional aggravations, types of cough, asthmatic, breaking, choking, exhausting, hacking, coughs associated with different illnesses and other associated activities. So there are many um, good sections in the repertory to help you find a select group of remedies. So let's uh, begin the materia medica. The first one we're going to talk about is Baronia alba. And Baronia alba is uh, a remedy that colds go right to the chest. So this is the type of individual that, they get the flu and then they get kind of like the chest cold. And this develops slowly over 2 to 3 days. So this is a slower acting remedy compared to the fast ones. Dry, hard, painful. One thing that's characteristic about Baronia is that any type of motion or movement really causes a problem. Pain. So when they cough, they get pain. They have to hold their chest. And the Baronia has a extremely strong thirst, coated tongue, and constipation. So We always like a homeopathic remedy that has a strong concomitant. Like concomitant is a symptom that occurs along with the main complaint. So this constipation is something that is prominent with Baronia. So remember Baronia, colds that go to the chest. It's a slow acting remedy, um, painful coughing, strong thirst, coated tongue, constipation. Causticum. We talked about causticum as a bilateral pharyngitis remedy, a dry, irritated cough, aggravated laughing and talking, a lot of bronchitis, a lot of mucus in the lungs, and it's a crescendo cough. What is a crescendo cough? That's a cough that keeps on rising. So it's that's the crescendo cough, characteristic of causticum. Ameliorated by cold drinks, hoarseness, and there was a question about singers. Well, causticum is also a big remedy for speakers and singers. So just don't think it's argentum nitricum. Causticum could be the remedy. Incontinence with the cough. Coughing so hard you're losing your urine. So the crescendo cough, a cough that aggravated by laughing or talking, and incontinence. So there's a lot of really good, juicy peculiars here with causticum to help you think of that remedy. Coccus cacti. These are coughs that come in paroxysms, very severe, choking with the cough, um, mucusy, cough up mouthfuls of ropey string. Um, so think of coccus cacti as the paroxysms, very severe in pertussis, which is a viral infection, severe coughing, high pitched cough, and time aggravation, 6 a.m. to 11:30 p.m. So it's worse in the morning. Aggravated lying, warm drinks, warm room, ameliorated in open air. Coccus cacti. Um, Ipecacuanha or ipecac. The characteristic with ipecac, it's associated with nausea and vomiting. So coughing so hard that you're vomiting. Coughing so hard to the point of cyanosis. Cyanosis is a blueness. Coughing with blood. So this is a remedy when you think of this in a severe case of pertussis or severe coughing, coughing so hard they're vomiting, coughing so hard with blood, a remedy for COPD, which is chronic obstructive pulmonary disease, aggravated heat, and they're irritable. Now, ipecacuanha, is a big remedy for many conditions associated with nausea and vomiting. Um, so that is the characteristic feature of this homeopathic remedy. When you have any symptoms that are tied into nausea and vomiting, you think of ipecacuanha. Calibichromicum. The main feature of this remedy is the very thick, stringy, green sputum, ropey mucus. This is the mucus that it stretches. It stretches and it doesn't break. Aggravated eating, morning on waking, rattling respiration during sleep, a tickling sensation, ameliorated warmth, warm room, cough or coryza or sinusitis. Um, the main features to remember with this remedy is the rattling respiration during sleep and the productive cough that has a very thick, stringy, green sputum. Remember, we talked about The main differential when you're trying to determine what homeopathic remedy to use for a cough is what? Is it dry or is it wet? This is a remedy for a wet cough. It's a productive cough. Cali carbonicum, and it's similar to causticum, loose cough with lots of mucus, and it has a time modality. It's aggravated 2 to 4 o'clock in the morning. Vomiting with cough, better sitting up, bending forward. Aggravated from cold. So that's a feature that can help you differentiate the cough is what makes the cough better, what makes the cough worse is a certain position. You have already noted that I'm going through these remedies. Some of them are better, the cough is better sitting up. Some of them are aggravated lying, etc. So position, temperature. You're probably already noting that some of these remedies, the cough is better warmth, better cold, worse warmth, worse cold. All these things are tricks to help you determine the best homeopathic remedy. Phosphorus is a big remedy for bronchitis and pneumonia. And every time they get a cold, it goes to the chest. Hoarseness, aggravated lying on the left side, talking and laughing. Very thirsty, and they like ice cold drinks. And this is a peculiar feature of phosphorus, extremely thirsty, and they like ice cold drinks. And we already covered another remedy that's extremely thirsty, and that's baronia. But phosphorus is, you'll find that every homeopathic remedy kind of has um, a predilection towards a certain part of the body. And phosphorus is one remedy that tends to go to the lungs. And that's why every time they get a cold, it just goes to the chest. So remember the bronchitis or pneumonia associated with the cold, the hoarseness, and the fact that they're very thirsty. Also, the phosphorus, they tend to be very friendly people, sympathetic, warm people. They're not irritable, like the nitric acid and the arsenicum album. They're very, very friendly. Pulsatilla nigrans, it's a common remedy in children. And pulsatilla, when I hear the word pulsatilla, I think of juicy. Lots of tears, lots of mucus, a wet cough. Comes on at night, waking in the night, aggravated lying down, a warm, stuffy room. They like an open room. So this is a big remedy in children. The cough wakes them up at night. There's a lot of production, better in the open air. They do better if you open up the windows or have the AC up. Combination of asthma, allergic rhinitis, and cough. So this is a big cough remedy to think of in children. Rumex crispus, a dry cough, a tickling sensation, aggravated by changes in the air on covering, 11 o'clock in the evening, in the morning after rising. Sensitive to touch. So the Rumex has this hair trigger in the larynx and trachea. So the main feature that I think of this is this tickling, this unbearable tickling sensation in the throat, something that makes a dry, you just can't get rid of that tickling sensation. It's the trigger. And they're very sensitive to changes in the air, air temperature, air movement. So tickling sensation. Spongia tosta is another dry cough, a big remedy for the croup. A hard barking cough, a hard cough, and hard cough is a low sound. A barking cough is a high sound. It's kind of like the barking of a seal. And it's from the larynx to the upper chest. It's aggravated at night, midnight, ameliorated eating or drinking. So remember, a hard barking cough, kind of like the sound of a seal. And so a lot of these homeopathic remedies for cough have a peculiar um, feature in terms of the sound. Sulfur is similar to pulsatilla, a nighttime cough in children. Their aggravated warmth um, and a lingering cough that wouldn't go away. Remember, we talked about sulfur for the pharyngitis, a bilateral tonsillar remedy, a lingering pharyngitis that doesn't go away. So anytime there's a condition that lingers, it just doesn't go away, think of sulfur. So there's three main remedies for croup: uh, aconite, spongia, and hepar sulphuris. And in the repertory, you can look under cough, croupy. And aconite is for the earlier stages of the croup. And aconite is a very fast acting remedy. Things come on suddenly. So there's usually a trigger. Sometimes there's a trigger by exposure to cold, dry wind. Uh, Aconite is also interesting that it can come on after a shock or fright. So we're not only talking about croup, but even an eye infection that comes on suddenly and violently, maybe after a shock or fright or exposure to cold, dry wind. Aconite, an abscess that comes on suddenly, flu that comes on suddenly, a stomach problem that comes on suddenly. So, there's certain themes with certain homeopathic remedies, and aconite is a remedy to really think of when symptoms come on suddenly and violently after a shock or fright. It usually starts in the evening. It's a dry, barking, suffocative cough with anxiety. That's the other feature that aconite has: strong anxiety. And it's ameliorated in open air. Ameliorated in open air. Kind of like pulsatilla and sulfur. Both of those are ameliorated in open airs. So the second remedy is hepar sulf for the croup. Aggravated being outside, aggravated cold air, sharp splinter pains. And the characteristic feature of hepar sulf is the level of pain. They're sensitive to the pain. They're desperate with the pain. Spongia tosta. Um, this sounds like a seal barking, as I mentioned. Stridor or inspiration after the cough can be quite loud. So the breathing in, they're making a noise every time they inspire. There's it's called a stridor. You can hear the ear going into the bronchioles. They're ameliorated, leaning forward, and ameliorated sucking on hard candy, which is a very peculiar symptoms, and sometimes sounds like a saw-like, the spongia tosta, either like a sill barking or a saw cutting through wood. Ammonium tartaricum is a catarrhal croup. Catarrhal is a discharge croup with rattling, and this can be confused with calcium bicromium. We talked about calcium bicromium has that rattling to thick mucus and wheezing, ammonium tartaricum. So other remedies, calcareous sulph, Coccus cacti, and Cuprum metallicum. Cuprum metallicum we'll probably be talking about later in the course, but this is a big remedy for spasms, so like a spasmodic cough. And cuprum can also be a remedy for spasms anywhere in your body. It can be a spasms in your hand or your leg and a spasmodic cough. Pertussis and whooping cough can be treated homeopathically fairly easily. Characteristic with pertussis and whooping cough, not unusual to have vomiting accompanied by the cough and worse at night. They're the three main remedies: belladonna, ipecac, and drosera. If you recall, ipecac is the number one remedy to think of for vomiting. Arnica. You really don't think of arnica for cough. We reviewed arnica as the number one homeopathic remedy for trauma, but the cough is essentially causing the body trauma in the body, so the body feels sore and bruised and stiff. You can also get a nosebleed or a conjunctival bleed or scleral hemorrhage from the cough. Also, a moodiness, a weeping when the cough is coming on. So, when the cough causes damage to the whole body, arnica might be the remedy. Belladonna, early stages of the cough, especially when there's flushing and severe headaches. Strong stridor and spasm, whistling quality. The stridor sounds like a kettle or a train whistle. And remember, with belladonna, we're dealing with fever, red, or heat. So that's the characteristic with belladonna. So fever, redness, and heat. Carbovegetabilis is a remedy that you think of for a lot of weakness with the cough. So these are people that are really depleted. They're on the verge of collapse. So the cough has really gotten the best of them. The face is cold, clammy, and bloated, aggravated, lying, better uncovering. So the carbovegetalis is a person that is kind of sick, really weak after a cough. And I was taught in homeopathic school that carbovegetalis gives life back to a dead person. When they're really depleted and weak, carbovegetalis can turn someone around. Causticum, a short, hollow cough with tickling, and may lose urine with the cough. We already mentioned that. And aggravated warmth. We already talked about Coccus cacti. It's a paroxysmal cough, ropey mucus in the mouth. Cuprum metallicum, strong spasms. The cough is so bad they have this feeling of suffocation. Very violent cough. The two homeopathic remedies for the most violent of all violent cough is drosera and Cuprum metallicum. These are for extremely coughs that are spasmodic, that the patient or person just can't stop. The Cuprum also has this peculiar thing: 3 coughs in a row, and then it stops. And they stop, and then again. So that's the peculiar feature with Cuprum metallicum. Durca illustra, constant coughing with gagging and vomiting, suffocation with much hoarseness and rawness. So this could be compared to the ipecac remedy, the coughing and the gagging, suffocative with much hoarseness. So you can see that there's many cough remedies. Um, and this may seem extremely confusing initially because of what to do when you have somebody that has a cough. And as I mentioned, number one, as you're trying to analyze for a homeopathic remedy, you want to first find out the onset. Was it rapid or slow? You also want to know if it's a productive uh, or non-productive. If it's productive, what kind of mucus are they coughing up? You also want to know the nature of the cough. You also want to know time of the day, what aggravates it, and associated symptoms. So usually when you uncover all these things, you can narrow it down to one or two remedies, and you have to be a homeopathic detective. Drosera rotundiflora is the best remedy for pertussis, the most violent and terrifying, distressing, and painful. Comes on suddenly over and over. Hard racking cough, have to hold their chest, usually vomiting and nosebleed. So when you have a combination of a violent cough and nosebleed, think of Drosera rotundiflora. And also, the other violent remedy that we talked a little bit about was cuprum. Uh, Euphrasia. So eye symptoms involved with the cough. Euphrasia is a big herbal remedy. It's called eye bright for the eye. And when you have eye symptoms involved with the cough, think of euphrasia. So this would be profuse lacrimotion, profuse tearing during a cough. Coryza and cough only during the daytime, not at night. That's the other peculiar feature with euphrasia. Um, we talked already about ipecacuanha or ipecac, a big pertussis remedy, nausea and vomiting with the cough. Um, so Cali carbonicum has the peculiar worse worst 2 to 4 a.m., swelling around the eyes, below the eyelids, vomiting with the cough, the eyes bulge with the cough. So the peculiar time, 2 to 4 a.m., and swelling around the eyes, bulging of the eyes. Um, Lachesis, we already talked about as a left-sided remedy for pharyngitis, but lachesis is also associated with whooping cough, asthma, hoarseness, and the lachesis is a remedy that is definitely worse at night. Mephites, suffocating cough without mucus, um, aggravated night, aggravated lying, less expectoration or production, not as violent as Drosera, no cramping or nosebleed. So the interesting feature with this is the suffocating cough without much mucus production, and it's not as violent as the Drosera. So I would say that if you have the whooping cough and Drosera doesn't work, and cuprum doesn't work, but it is a suffocative cough, and maybe there's not as much expectoration, then Mephites should be given. But you can see that with these severe coughs, if you have the right homeopathic remedy, the cough should have a positive effect almost instantly. So when you have these paroxysmal coughs, um, give the remedy, and there should be a positive change. If there isn't, then go to your second or third choice based on the symptoms. Phosphorus, another um, a useful remedy, uh, but this is more towards the end of the whooping cough, not at the beginning. It is after the course of whooping cough becomes more prolonged. So when it's a long-standing whooping cough that just isn't getting better, phosphorus. And I think the reason why is that phosphorus is often the constitutional remedy for these people. By constitutional, it's the deep acting remedy that they need to strengthen their whole body. So often, when you have an acute case that just doesn't respond, then you need to consider phosphorus. Pulsatilla nigrans in the early stages of croup, lots of mucus from the beginning, worse heat. And as I mentioned, pulsatilla is a homeopathic remedy for uh, a lot of wet discharge. It's a wet, juicy remedy. So lots of mucus, tearing, maybe weeping, crying, just a lot of juice that comes from the person. And pulsatilla is always worse heat. They just don't like the heat. Okay, why don't we finish with influenza? Um, because homeopathy is just a wonderful way of treating influenza. And we have the flu season coming up. And I'll send everybody a link. I gave a lecture at an international meeting in Toronto on the homeopathic treatment of chronic epidemics. And believe it or not, homeopathy has stood the test of time with all the major epidemics that have occurred in the United States: the cholera epidemic, the typhoid epidemic, and the Spanish influenza. The success that homeopathy had in treating the Spanish influenza was unbelievable. Under homeopathic treatment, the mortality was less than 3%. The mortality under traditional treatment was as high as 80%. And I'm not just talking about anecdotal reports of homeopaths. Um, Akron General Hospital reporting on 27,000 patients treated. Um, Phenomenal, phenomenal. So I'll send you a link of the talk that I gave on that. But let's talk about influenzas and cold. Um, First, do you need a remedy? Um, a lot of times when you do get a cold or flu, it's the body telling you you need to rest and just take it easy. Um, so, rest, fluids, gargling, tea, chicken soup, etc. Um, Veronica talked about the constitutional remedy. A lot of times just repeating the constitutional remedy, those will strengthen your body. Um, and the other comment, you know, a lot of times a mild cold or a flu is just a self-limiting process. I do think it's essential for us in order for us to strengthen our immune system. Um, we need to have these exposures of these viruses. It helps stimulate our immune system. But when you do need a homeopathic remedy is when you're severely limited, when you can't function. So when you're looking for a homeopathic remedy for influenza, the colds, and the flu, you want to look at the coloration of the person, the sweats, the odors, the mood, um, temperature, as we emphasized over and over again, how rapid the onset, inciting circumstances. Um, are there pains in joints and the muscles, time of aggravation, fever, chills, headache? All these things will be helpful in determining the remedy. Many times it's hard to sort out the remedies uh, because the symptoms are changing. So I usually go with one remedy for 24 hours. If there's no improvement, go to the next one. So unless you get it immediately, you need to wait until the symptoms develop. So you're always following the symptoms, because in many times the cold and flu, things will change over time. Okay, so the two big remedies for the onset of influenza, and I know these are in your home remedy kits, and I would make sure that you keep them handy. Aconite, sudden onset, anxiety, restlessness, dry skin, dry cough, dry mouth, fever, thirst for cold liquids. So uh, there's this anxiety associated, this restlessness, this dryness. That is the hallmarks of the aconite. So many times when I get that feeling that I'm exposed to the flu and I know it's coming, because you just have that sensation, and of course you have that slight anxiety. Aconite, take the aconite immediately. Belladonna also has a sudden onset, but there's more redness, flush, heat, hot head, high fever, restlessness, delirious. So there's a difference between the aconite and the belladonna. In the aconite, there is more dryness. The belladonna, it's flushed. Um, both can have a high fever, but usually the fever is higher with the belladonna. Um, there's anxiety with the aconite, less anxiety with the belladonna. Restlessness is in both cases. Belladonna tends to settle in the head, so there'll be more headache and also craving for lemons. Ferrum phosphoricum. Fever is not as high as belladonna or aconite, less restlessness, flushing in the face, and also circular patches on the face. Um, so the big three remedies for the early onset of the flu are aconite, belladonna, ferrum phosphoricum. Oscillococcinum, and you may have seen this at many, many health food stores. It's produced by Barone, um, and it is considered by many homeopathic doctors as a good first line of treatment for the early onsets of the flu and as a prevention. Oscillococcinum, and it's made from the duck liver that's infected by the flu virus. Um, so, general flu remedies, and I'm going to go through these. Allium cepa, which is the onion. What happens when you peel an onion? You get clear, uh, burning nasal discharge that irritates the nostrils and upper lips. So you may have seen kids or people with a cold, and there's redness below their nose because of this burning discharge. They're aggravated in a warm room, ameliorated in open air, tickling in the larynx, not much fever, quite thirsty. Um, but the key with the allium sepia is the clear burning nasal discharge that irritates the nostrils. Euphrasia is another big flu remedy that also is good for treating bronchitis. It's different than allium sepia. You get a lot of lacrimation. So with allium sepia, you get a lot of discharge from the nose. With euphrasia, you get eye symptoms, watering from the eyes with an acrid lacrimation, photosensitivity, and you get a bland coryza from the nose. So that's two key ways of distinguishing allium cepa from euphrasia. We mentioned with allium, let's see, let me go back here. Here we are. Clear burning nasal discharge, it irritates the nostrils. And euphrasia you get the clear burning discharge from the eye, bland coryza from the nose. Now, gelsemium is a remedy that is much different than aconite or belladonna, a slow onset, more common in warm weather. And the three D's to think of with gelsemium are dizziness, drowsiness, and dullness. Thirstless, trembling with weakness, drooping of the eyelids, wants to be left alone. So you know what this is like. This is when the flu really hits you. It's usually a slow onset. You're sick, you're weak, you just lack color, sneezing, coryza, occipital headaches, aggravated at 10 a.m., ameliorated bending forward, open air, and propped up. So gelsemium, a great homeopathic remedy. Slow onset, common in warm weather. Remember the three Ds. But this is different. You would never consider gelsemium for an acute onset with the flu. A sudden onset, gelsemium is a slow onset. Natrium muriaticum has few distinguishing symptoms. Copious nasal discharge, whitish, consistency of egg white. Loss of sense and smell. Herpetic eruptions around the mouth. So when you do have the flu and your immune system is weak and you get herpetic eruptions around the mouth, Natrium muriaticum. Natrium muriaticum is considered one of the top homeopathic remedies for herpes outbreaks around the mouth. But that doesn't mean that every herpes outbreak can be treated successfully with Natrium muriaticum. If you look in the repertory under face, herpes, there are 50 or 60 possible remedies. So you really have to know the person. You have to look at all of these different modalities to determine the right remedy. But if you do have a herpes outbreak that seems to occur with the flu, Natrium muriaticum is a great remedy to consider. They're also depressed and weepy during the flu, much like pulsatilla. Nux vomica, colds develop into the flu. These are irritable people. They don't want to be touched. Leave me alone. I don't want to be treated. They cannot bear noise, odor, or light. They can get occipital headaches, tight, dry cough, throat is rough, scrape feeling, nausea. They want to vomit, but they can't. Bruised soreness of the abdominal walls. So remember this as a flu remedy. Irritable, chilly, don't want to be touched. And irritable chilly, there was another remedy that we talked about earlier, chamomilla. They're irritable. They don't want to be touched. Um, but Nux vomica has this nausea, the bruise sensation in the occipital wall. So a big flu remedy. Colds develop into the flu. So influenza with aching. And I want to talk about this because when you have physical pain in your body, muscle aches, pain and movement, four remedies to think of: arnica, boronia, eupatorium perfilatum, and rust tox. And let's talk about each one of them, the characteristics. And of course, the aching characteristics of these four remedies you can use to treat people even if they don't have the flu. But these are the four ones that show up with the flu. Arnica, most common flu remedy brought on by overwork and physical exertion. So those of you that are run down from physical exertion and you get the flu, could be arnica. Sore and bruised all over, don't want to be touched, like Nux vomica, chamomilla. The interesting thing about arnica is they minimize their symptoms. Leave me alone. I'm all right. I'll be okay. Not like chamomilla, where they want you to know what their symptoms are. And the same thing with nux vomica. They're irritable. You'll know that they're irritable. Arnica, they minimize their symptoms. Tend to be more fearful at night. Overall state is kind of sleepy, and they're in and out of sleep. They don't really get a good night's sleep. Baronia, slow onset, worse at 9 o'clock at night, is the grumpy bear. Baronia is the grumpy bear. Aggravated by slightest motion. Irritability, wants to be left alone. So it's a little bit different than arnica. Arnica wants to be left alone, but it doesn't have this extreme sensitivity to slight motion. Baronia is extremely thirsty with a dry mouth. They drink a lot of water. Stitching pains in the muscles, joint pains, ameliorated by pressure. Bursting, splitting headaches, um, as if hit by a hammer. Tongue can be coated yellow or dark brown, nausea, swollen liver. So Baronia is the grumpy bear, aggravated by slight motion, irritability. Eupatorium perfilatum is a great remedy for deep and severe bone pains. These are people that feel like their bones are so sore that they're broken. They can't walk, they don't want to be touched. Severe, severe bone pain. Chilly, but prefer cold drinks with ice. Aggravated motion due to the aching. Hoarseness, aggravated in the morning, 7 to 9 a.m. Throbbing headaches, cracks in the corner of the mouth, diarrhea, green watery, chronic loose cough at night. But for me, when I hear of somebody having um, a deep, deep bone pain, I think of Eupatorium perfilatum. Russ talks, aches and pains, ameliorated continued motion. Remember, we talked about rust talks. It's like a rusty hinge. They're a little stiff, but as they move, they feel a little bit better. They're aggravated in the morning on waking. Um, Comes on after exposure to cold and damp. Other characteristic, ameliorated by hot baths and stretching. And we already mentioned that red triangle on the tip of the tongue. Unquenchable thirst with the dry mouth and throat. That's the rust tox. Septic influenza. This is influenza where septicemia, the organism has gone into the bloodstream. And the remedies are arsenicum album, arsenicum iodatum, pyrogenium, baptisia, and mercury. I'm going to go through these fairly quickly because we are going to break for lunch very shortly. And we'll have a 1 hour break and we'll come back at 1 o'clock, but let me go through these. So remember, this is a septic condition: weakness, restless, fearful, um, aversion to food, smell, high fevers that peak around 3 a.m., burning, constricted throat. Want of company, they're fearful. They want people around them, they want to be taken care of. Diarrhea, stomach pain, ameliorated warmth, burning pains. Arsenicum is chilly, they like to be warm. They're fearful, they want company, they want to be taken care of. This peculiar aversion to food, the smell of food, high fevers at 3 a.m., characteristics of arsenicum album. Arsenicum iodatum is similar to arsenicum album, but a tendency to more have swollen glands. Baptisia is a stuporous mental state, yellow tongue, GI symptoms with nausea, diarrhea, putrid offensive discharge, dusky, reddish, sickly look. Baptisia is usually the number one remedy that I think of in a septic state, stuporous mental state where you're septic. Mercurius vivus, um, flu with pus, offensive discharge. They get a metallic taste in their mouth, indented tongue with imprint of teeth, and all the Mercuries have this salivation and they drool in their sleep. Thirsty, they want cold drinks, and unstable body temperature. Pyrogenium, high fever pulse, aggravated cold, ameliorated heat, stuporous condition, delirium, sepsis or septic like conditions, thirst for cold drinks, offensive discharge. Once again, these are very serious states that the patients are in. And in most situations, I would not advise a beginning homeopath to treat these conditions. They should be evaluated. But once these people are evaluated in the emergency room and maybe they're prescribed an antibiotic or whatever, the homeopathic remedies can be given as an ancillary treatment. GI influenza, um, and this is gastrointestinal problems. And let me just finish by talking a little bit about the genus Epidemicus, and then we'll break for lunch. The genus Epidemicus is that when we do have an epidemic of influenza, the flu, there are certain characteristics which occur. And Hahnemann had noted this. And when these characteristics are determined, the homeopathic remedy becomes the genus epidemicus, the remedy for the epidemic. And this is held true in the history of epidemics. Like, for example, the Scarlatina epidemic that swept Germany between 1800 and 1808, aconite was a specific remedy. Um, Eupatorium perfilatum was found to be a remedy for the influenza epidemic. Camphora was the homeopathic remedy for the Asiatic cholera. And Thuja occidentalis was found to be the prophylactic treatment of smallpox. So it's kind of interesting. And as a homeopathic doctor, when we do have major epidemics, the homeopathic community gets together. And there are some websites and individuals who study the genus epidemicus. And once the genus epidemicus is identified, then all homeopaths are notified. So the answer to major epidemics is not a prophylactic vaccination. It's not an antiviral medication that Big Pharma is trying to sell you. It's the genus epidemicus. And as homeopathic doctors and the homeopathic community, we're always keeping our eyes open for this. So what I want to do is I'm going to end right now. We'll take a break, and we'll be back at 1 p.m. Eastern Standard Time. So everybody enjoy your break, enjoy your lunch, and see you at 1 o'clock.